Back, everyone. Mindmap helps teens and young adults across Connecticut reach out and seek early treatment for psychosis, which may be a symptom of a mental illness. And Dr. Vinod Srihari, who's the professor of psychiatry at the Yale School of Medicine and director of the STEP program, and Kim Beauregard, a licensed clinical social worker and president and CEO of Intercommunity Healthcare, join us now. So we want to start with what Mindmap is.
So Mindmap is a campaign that's trying to help young people with a new onset psychotic illness access care as quickly as possible.
I have to imagine, too, that for someone who might be dealing with a mental health crisis, it can be incredibly overwhelming and at times isolating. So finding a community and mostly finding answers is critical. So you're one of the mental health providers within Mindmaps, Kim. So tell us why this partnership is so important.
It is so important to us at Intercommunity and for, for our youth. We are the local mental health authority we're one of them for the greater Hartford, East Hartford, South Windsor area, and a lot of the surrounding towns. We actually do take people for clinical services from anywhere. And so we are honored to be a part of this with Vinod and the Yale School of Medicine. We know how important it is. We've been doing this work, for 50 years as a local mental health authority. And so we know how important it is to have rapid access to services because it's too late by then, And it can be such a debilitating illness. That when people say they want help, we want to get to them right away.
And it's so important to start an open dialogue when it comes to mental health. So let's talk about what psychosis actually is.
Sure. So psychosis is the name for a collection of signs and symptoms. For example, people who hear hallucinations, they may hear sounds or voices when no one is around. They may feel things. They may smell things. They may feel like their thoughts are not connecting with each other. They might talk in ways that are very disorganized. They may act in ways that are very disorganized. People might pay less attention to their hygiene. They may dress in unusual ways. And finally, they may also withdraw from others. And this is the trickiest sign where it might be confused with depression or something else. But when it's psychosis, this is a sign that the person needs evaluation and potentially treatment. The good news is that treatment works. And like with many other illnesses, the sooner you come in for evaluation.
Whole person, right? So we do an assessment on your physical, your mental, if there's any substance use. We're going to do assessments on all of that and integrate all of those together. We want it to be individualized. We want it to be with the preferences of the person who's experiencing the illness. It's like we know if you don't want to take the meds, you're not going to take the medication, right? And that's hard for a lot of people to accept the treatments. So talk therapy is always, for me, as a social worker, the first thing is about building a relationship, a trusting relationship and connection, whether talk therapy is group or individual. Medications is very important. There's biological issues involved with some psychoses. A lot of times this also happens, which we see with our youth, which the onset of this is really between 16 and 35 years old. That they do withdraw. As the doctor said, they start to withdraw, and people, the family, the caretakers aren't sure what's going on. So we want to get them rapid access, get them into treatment. And for us at Intercommunity, one of the most important things is our recovery support specialists or peer specialists, and we're in the community. We go to people's homes, we go to where they are, we meet them where they're at. But to have someone there who has experienced the same thing that someone is going through, that's where you can really start to build a relationship and have hope, that give the person hope that, I had these same signs and symptoms. I'm taking medication now, I'm doing this now, and I'm also working here now. So that's what we like to really focus on also.
And who would qualify for Mindmap's referral program?
So you just have to be between the ages of 16 and 35 and live in the state of Connecticut. Doesn't matter what insurance you have or don't have. And if you're within the first 3 years of a psychosis onset, you're in.
And if you'd like to learn more about the services provided through Mindmap, you can call 203-200-0140 or visit mindmapct.org. And stick around because CT Live continues right after this.